Hi, I'm Dr. Henry Kamali, and I'm the Medical Director of Surgical Services here at Good Samaritan Hospital. Today I want to speak to you about Enhanced Surgical Recovery, or ESR. ESR is a collaborative care pathway designed to achieve early recovery for patients undergoing surgery and represents a paradigm shift in two ways. It re-examines traditional practices, replacing them with evidence-based best practices when necessary, and it is comprehensive in its scope, covering all areas of the patient's journey through the surgical process. Utilization of ESR protocols have demonstrated reduction in postoperative hospitalization and complications. The key factors that keep patients in the hospital after surgery include the need for intravenous pain medications, the need for intravenous fluids secondary to gut dysfunction, and lack of mobility. Now, to address these issues, we strive to optimize nutrition by giving you a carbohydrate drink several hours prior to surgery so you can start healing right away. We perform an opioid-sparing anesthetic by utilizing pain medications from various non-opioid classes and performing advanced nerve blocks when applicable. And finally, we utilize goal-directed fluid therapy to ensure you receive the exact amount of hydration your body needs. Post-operatively, we want you to be able to drink, eat, and mobilize. That means we have to make sure you're not tethered to anything, such as an IV pole or urinary catheter. We have to make sure that you're comfortable and that your pain is well controlled. And we also have to make sure that you're not nauseated, which is why your anesthesiologist will often administer preemptive anti-nausea medications at the end of your surgery. Ultimately, our goal is to get you back to your usual activities as soon as possible. So your anesthesiologist, surgeon, nurses, and you all play an important role in getting you there. No matter where you have surgery, you should inquire about ESR, and may you have a speedy recovery.